Again, welcome to the first webinar of the Language Access Continuing Education series. Excuse me, my name is Susan Clifford, and I work as the Language Access Coordinator at the UNC Institute for the Study of the Americas in Chapel Hill. So what is an interpreter? Most of us on this call already know, and most of us already know that people who are bilingual speak two languages fluently. So with the example on the left, the bilingual individual does not need the services of an interpreter. They can speak directly to another bilingual or monolingual person who speaks the same language or languages that they do. However, the people on the right do need an interpreter to serve as a language bridge or a conduit so they can talk to each other. And now I wanted just to talk a little bit about the difference between an interpreter and translator. Sometimes people really use these terms interchangeably, but these professions really involve different skills. So an interpreter is someone who adapts oral speech from one language to another without loss or change in meaning. People who use American Sign Language and speak English are also called interpreters as well. And a translator is someone who adapts written text from one language to another with consistent and accurate meanings. Both are bilingual, trained, and skilled professionals. And often we hear about people talk about interpreter certification, or who's a certified interpreter? Are you a certified interpreter? So here I wanted to differentiate between a qualified and a certified interpreter. A qualified interpreter is an individual who has been assessed for professional skills. They demonstrate a high level of proficiency in at least two languages, and they have the appropriate training and experience to interpret with skill and accuracy while adhering to a national code of ethics and standards of practice. This is different than a certified interpreter who has taken additional steps. So they're qualified and they've taken additional steps to meet the requirements and pass the exams of a certifying body for their specific profession. So for example, a certified medical interpreter, a court interpreter, or in the case of translation, a certified translator. People participating in interpreter training may receive a certificate of completion of a training or course but a certifying body like the National Board of Certification for Medical Interpreters is the only type of agency which can provide professional certification, right? So how can you know if someone's certified or share with someone if you are certified? Certification can be indicated through putting letters after your name. So for example, if I were to take the exam and go through the steps with the National Board of Certification for Medical Interpreters, I could put CMI for Certified Medical Interpreter after my name. Like when I sign my name or list my name, I could put Susan Clifford, comma, CMI. And then once certified, an interpreter has to take continuing education courses and pay dues in order to maintain their certification. That said, currently many agencies do not require certification. It can be very expensive and can be difficult to pass the certification exams. Also, certification is not available in every language currently. However, it's important that when agencies hire an interpreter, that they do some type of assessment of language skills, interpreter skills, and professional knowledge prior to hiring someone so that they can ensure that person is qualified. And then also agencies should avoid using family members, children, friends, and untrained volunteers as interpreters. So why is this the case? There many, many reasons, unfortunately. But I know even if for those of us who haven't been trained, maybe many of us may have had to serve as an interpreter out of necessity for somebody else when there wasn't another option, right? However, best practice is really for everyone to use a qualified interpreter provided by the agency. So, for example, if it's a family member or friend, they may not keep things confidential fully. It may be that a person doesn't want their friend to know their personal financial situation. Or maybe they don't want their child to go into a medical appointment with them, or their partner to be present when they're trying to ask for help around a family violence situation. Also, when family or friends are used as interpreters, sometimes folks may summarize information or answer for the person. It's harder to have those professional boundaries when it is a family member or friend. And having a qualified interpreter can make things more impartial and take out the element of bias. And then also a qualified interpreter would know the specialized vocabulary. So a family member or friend may not know all of the terminology around a healthcare or a legal issue. And really, it is the agency's responsibility in most cases, because any agency receiving federal funds should be providing language access and should be providing qualified interpreters and or bilingual staff. So what does an interpreter do? There are lots of different roles. In the case of medical interpretation, where I was trained, this is sort of how we were guided. So really starting at the bottom with the foundation, an interpreter's main role is that of a conduit, who literally conveys what is said in one language into another language without additions, omissions, or edits, right? That is the main thing that an interpreter does. Occasionally, an interpreter may also ask for clarification when they don't understand a term or maybe notice that the listener is not understanding the speaker. Or maybe they just need to step out for a moment from their role as conduit to clarify something for a moment, and then step back into that of the role of a conduit. And then in rarer cases, an interpreter may prompt a speaker to gather more information to be better informed if they notice, for example, that there's a potential cultural misunderstanding. They wouldn't explain the cultural misunderstanding or a cultural belief, but they would rather prompt someone, the speaker, to ask about it or to explain a certain situation that might help remedy a cultural misunderstanding. And then very infrequently, an interpreter may step out of their role to advocate, for example, in an extreme circumstance that involves abuse or harm. Excuse me. So we may each be led really into the interpreter profession in different ways. As I mentioned before, sometimes it's out of necessity, helping out a family member or friend. It may be on purpose that this is a passion and something that we want to do, or we may just kind of by accident find ourselves being asked a lot to interpret. So how does one kind of get on this path to becoming a professional qualified interpreter? The basic skills as I put on the flyer for this are, do you speak 2 or more languages? So really you need to start off by being bilingual or multilingual. You may gain those language skills through formal education or through personal and professional experience, but really becoming truly fluent in 2 languages, 2 or more languages. And then next, getting professionally trained on interpretation, standards of practice, codes of ethics, and skills, really helping to understand how this is different than speaking directly yourself in another language to someone else, right? It's being a conduit, a mediator, a bridge in between two people, two or more people, where you are connecting them, and learning those skills and those standards of practice are essential. Then after you have the foundational training, you may possibly want to seek specialty training. If you're interested in working in healthcare, maybe, or the courts, or in conferences, you will want to test your language and interpretation skills, get evaluated. This may be a language proficiency test, a course exam if you're taking a course, or an interpreter training test, a test at the end of an interpreter training. There are some standardized tests, and then also agencies may require additional testing. Often before folks are hired, an agency may want you to have some experience. They may say, where have you interpreted before? I see you have the skills, but where have you done this? What is your experience? So you may want to start by volunteering, shadowing another interpreter, or maybe practicing some in your workplace. And then finally, you'll be ready to develop your resume and really connect to interpreter professional associations, network, and really commit to ongoing professional development. You may choose to seek certification or maybe not. Either way, you can move forward as a qualified interpreter. And as I mentioned, once you have the foundational skills, you may want to explore some specialties, maybe methods or models of interpretation, or different modes of interpretation. You may want to do in-person interpretation. Maybe it's really important to you to be with other people, right? Like to actually be in the room and be able to see the nonverbal language as well as the verbal language. Or maybe you want to do remote interpretation, maybe by phone or video, or maybe all three. You may also, as you're learning skills, kind of decide if you're more drawn to simultaneous interpretation, which is what Tilde is doing right now for us. No pauses. This is often used in training and conference settings where they are listening and speaking almost at the same time. That is a special skill. And alternatively, you may want to do consecutive interpretation, which is what I'm more used to doing, where you wait until each person finishes speaking before interpreting for them. So, for example, in a medical appointment, the doctor would speak, the interpreter would say what they said, and then the patient would speak, and then they would say what the patient said. That would be consecutive interpretation. And then kind of the third thing you may want to decide is where might you want to work? And that will help you know what type of training and specialization you will need. There are different kinds of places to work. For example, you may want to be part of an agency as a staff member, a staff interpreter who regularly interprets for other staff members and clients. For example, a Department of Social Services interpreter. Or you may want to work for a language service agency where they schedule you to work for various agencies in person or possibly through phone or video. For example, you could work for a local company like Chicle Language Institute, or the Interpreter Bank at the Center for New North Carolinians, or a national or international agency like Language Line. You could also be an independent contract interpreter. You could have your own business and contract directly with different agencies that interest you, where you would like to interpret. In that case, each agency may want to test your skills or have some sort of proof of your skills. They also may require you to get insurance for errors and omissions in case you make mistakes in a high-risk situation. But you would have the ability to work in many different spaces, set your own hours, and you would not have to pay overhead to a language service agency. And then there are also cooperative models like Tilde, who again is on the call with us today, and Sensontle, which are two language justice cooperatives in North Carolina, where you can work as an interpreter worker owner. All right. And then lastly, there are multiple ways to stay connected with other interpreters and associations. You'll see many here on the slide, and I will certainly share these slides with you afterwards. There's the American Translator Association, which has great resources online for interpreters and translators. In North Carolina, there's the Carolina Association of Translators and Interpreters, or CATI or CATI. That is also a great place to connect with other local interpreters and find out about educational opportunities. And then you'll also see here some great national associations with resources for healthcare, medical, educational, and judicial interpreters. In North Carolina, there is an Office of Language Access Services within the North Carolina Justice Branch, which coordinates court interpreter training and testing. And again, I will share this information with you afterwards as well.